So it's like a perfect storm in India. It's a combination of poor leadership, a lack of public health infrastructure. It's almost an entirely privatized health system, which means that so about 80% of care is provided in the private sector. So whatever public data surveillance they've got is not representative of what's really going on in the country. The leadership has been reluctant to use lockdowns and has been actually recommending against lockdowns. The other issue is we have these variants of concern. So there's several different variants circulating in India, but also this new Indian variant. And we're hearing reports of young people in hospitals and that it's different from the last wave, etc., that there's more young people. Without proper surveillance data, which they just don't have, it's really hard to get a handle on that. There's like a lack of consideration of how to manage all the undocumented workers and that kind of very marginalised population, which is a substantial number of people in India. Really, India needs to develop their own self-reliance and capacity. They have the human resources, they have the technical know-how, they've got the manufacturing capacity. What's missing is the political will to make it happen. Probably lockdowns are the only thing that's going to help at this point. Universal masking and mask mandates, I don't think they're well implemented there, as in the compliance. And again, it comes down to political leadership. The second thing is to really ramp up the vaccination program to make sure the supply is coming and do whatever it takes, whether it's to invest more in serum institutes so they can manufacture more, secure a supply of the raw materials, if that's the choke point, get vaccine from elsewhere. They should be able to ramp that up and get the vaccination program happening. Yeah, I don't think anywhere near the majority of the population has been infected. And we just have to look at Brazil to see that in places like Manaus, despite a majority of people getting infected in the first wave, they still got infected again in the second wave. And that's what, with these new variants of concern, that's the big issue, that, you could be susceptible to reinfection with a different variant, etc.